safely requires at least 2 staff members on the ventilator side of the bed, which you just
Good.
discussed.
Maneuvered leader should be standing right where I'm standing. They should be right up close and personal, or it can be somebody that's standing and watching everything. I prefer it to be somebody here that gets in deep. And also, before we even get to that, everybody that's coming in to help, mask, gown, gloves, even in the non-COVID era, we should be masking, because a lot of fluids, sometimes drips and things fly off. It's good to keep yourself safe and protected with PPE.
First thing it says is to tuck patients' arms under their sides. And then remove ECG electrodes to replace on the patient's side and
Great.
back when
Come on in,
patient
come on in,
is
guys.
tucked.
All right. So I don't like to do that first, and I'll show you why.
Okay.
So if step one is to tuck arms under, what are you guys gonna do? How are you gonna tuck arms under?
I was just
Come
trying
show
to
me.
figure that out.
What arms are you gonna tuck where?
Yesterday we did the arms down
Like that?
like
Yeah.
that. You want to
Okay. So he said arms plural. So you're doing the same with this arm?
Yes.
Okay, good. All right. What is that helping? Nothing yet.
Nothing. Not yet.
Nothing, right? So, a couple of important things. I wouldn't do the arms tuck under yet. We'll get there. So I think that the next step is whoever's the leader. The reason I like the leader to stand right here is because the leader can stand right here and say, okay, we're gonna take these leads off, we're gonna put our pads on, we're gonna move his whole body here, put it up to the side, and then come down. When I'm standing here, and I just did that with my hands, everybody in this room knows exactly what's gonna happen. And if anybody has questions, they can ask, because they just saw with hand movements what happened. What happens if I stayed back here and I say, all right, well, rotate him to the left of the bed?
Everybody's left is
Who's left? Which left? Should be patient left, but we don't all think that way. I'm looking at the bed, that's my left. So that's why I like the leader to stand right here to do that. So it's very important too that the leader walks through exactly what they're gonna do before we actually do it, okay? Another step, whoever's the nurse of the patient, a lot of these patients end up on pressors, go up on the pressors. Give yourself a leeway of 10 to 20 millimeters of mercury, systolic, MAP. Give yourself some buffer, because patients will become more hypotensive during the procedure. So if he's just hanging out with a MAP around 65, bump that up to 75 to 85 to give yourself an extra buffer with more pressors.
Answer that. Got that? I wrote it down.
FiO2 should be at 100%. It probably is anyway, because that's the whole reason we're proning. But again, just to make sure that FiO2 on the vent should be 100%. Is it okay to disconnect the ventilator during this? Yes.
It is?
It's not optimal, but it makes things a lot smoother. It's better to disconnect, prone and reconnect, than it is to pull. As soon as we start to pull, then it gets disconnected. We don't know where it got disconnected. Then the vent pulls, something
So
falls.
you control the
Right.
separation.
It's a controlled separation. Okay, I disconnected here. We turned, we put him back. We got his face in the mask just how we want it. Now I'm reconnecting. It's not ideal because we lose our recruitment, but at the same time, we can give a little bit because we need to make sure the process is safe and quick. When we do this safe and quick, it shouldn't take more than a minute, right? If there are complications, that's what causes delays and problems. Same thing with the leads. Can we have the patient off leads while we're doing this? I do, right? You can't possibly, you don't want to take the leads off after the fact, right? So, strip the leads here. I do like to put pads on beforehand and speak with the physician. Say, are we sure we have everything done we want to do? You've bronched him, you've lined him, we have a central line. If there's any chance he's going to need dialysis, do the dialysis line. Do all your lines and bronchs and everything before we flip. Okay, good. Now for the fun stuff. So now let's walk through it. So I'm going to remove anterior leads, and I'm going to put pads on, right? Do we have pads?
No.
Oh, meaning like EKG pads?
No, pads, shock
Oh, shock
defibrillation
pads.
pads. Because if a
Yeah.
patient goes into ventricular dysrhythmia, causing him to be pulseless, whether it's VFib or pulseless VTAC, we don't want to have to deprone him before we defibrillate him. Leanne? Okay. Okay, and at some point, you guys should try this with actual pads, with actual leads. We don't have to do it for this time, but just something for everybody to practice, because I don't know if Chris is ready. So, we're putting pads on, right? We'll take the forward leads off, and I'm telling everybody, here's the plan, and it doesn't matter which way you go, all that matters is that everybody's on the same page before you do it, right? So, let's say we're going that way, cause that's more common, right? So you guys come up close here. Pull Chris with the sheet over to that side of the bed. Pull, pull, pull. Okay, now bring him up. Good, now we hold right here, right? Now try to pull, now somebody should pull from here and pull him over some more.
Hello.
Good, now we're sideways, okay? Now is when you take this arm, lift, tuck. Same thing with the Foley. If all of these patients are gonna have a Foley, make sure the Foley's tucked so that when he's flipped, there's no pressure on the Foley or where the path of the Foley, right? So this goes under here, now I bring my blankets in. Oh. So push him a little bit more here. Good. We get the blankets under. Respiratory, grab over here, have Chris's head. Good, now come on down. Oh, hold on. All right, now come on down. So now we have the two respiratory therapists. One had the head, one has the airway. They're addressing all that. We put the leads back here. This arm came out nice. Look at how the arms came out
We're gonna
perfect.
put you in that.
Foley is already good.
Okay.
I think so.
Done. So now, the next step, now that we're done, we reattach leads, reattach A-line, IVs, whatever. I wanna check Chris's head,
Okay.
at his neck. Okay, lift up a little bit. And this happens almost every time we prone.
Is our patient gonna?
These aren't perfect, so what we do is we lift here at the shoulders and readjust so it's right under his chest. And now, we wanna check to make sure that his neck is freely mobile, no pressure. Then check under here, see how much pressure's on the belly, right? If there's still too much pressure on both, we add blankets. We add until we're all set and there's not pressure on either, right? But also, he shouldn't be like dangling too much. You guys will find that right median as you do it. So, did you wanna try?
Yeah, let's try that. So we put it on now, after we flipped him, right?
Most of the time, most of the respiratory, when our CRNAs do it,
Yeah.
before they do it, they put this on, have the tube through it, this goes on top, and they flip everything.
Oh,
Yeah.
like I was holding his head, I'd
Yeah.
hold that.
Here, lift
hold
your
this
head
in.
up a little bit. Yeah, usually this goes with him,
Okay, so I'd
but
be
this
holding
part,
that.
this
instead
part
of this.
stays down here.
Yeah.
This part, I've never seen this part go with him.
Okay.
Just whatever, like I said, down in the OR,
Become
some people do
disconnected
it
and
different
feeds
ways,
through.
so.
Oh, and one part I forgot at the pre, so before we do the proning maneuver, we put this on his face with where the ventilator tubing going and the NG tubing is, so that if we need to make adjustments, cut pieces out so the stuff runs better, we can do that with him laying supine before we prone him. Oh,
This is a lot more comfortable than yesterday.
Is it?
So this one's pretty good.
So
too.
this-
This one you can rip all the
I think I
pieces
can go
out
to
that you
sleep.
need to rip out for his eyes or.
Another
chin.
important
Yeah,
thing.
you can't, you can see him with that.
Yeah, that's why
Guys,
most of
let's-
them like that.
let's all
you can
pay
actually-
attention.
But we only got 4.
Joy.
right?
You guys,
So when we're proned and we have a patient proned in the bed, one difference between these and mechanical beds is one arm up, one arm down, and then depending on how you write your protocol, every 1 to 2 hours, switch the two. I usually do every 2 hours, but you can do it as frequently as everyone.
What about his legs? Do you do it?
Different nurses do different things. Some nurses like to put those little skin patches all across his entire body. Some don't. That's really up to you. That's a dealer's choice. And if you start to see some sores or something starting to form, boom, little elevation.
I should go to sleep.
Yeah.
See how comfortable it can be? And another thing, so with the ProSiva trial, everybody was proning for 17 hours, plus or minus, I think it was 3. But more recently because I do this almost for a living, and speaking with the big centers, UMD, Hopkins, all these big names that do it, they're all in agreement to leave patients proned until they're ready to be unproned, until they're better. It's not, oh, all right, we're proning for X amount of hours throughout the day. It's no, we prone until they're better.
Really?
Yep.
So, the HCA guidelines say 16-8 switch, so you're saying just keep them there until clinically they start to improve?
If you look at the ProSiva study, it did say for, I guess it was 16, I thought it was 17 hours per day plus or minus a few. However, they had that one study, they're not gonna redo the whole study just to
Right.
prove a different point. I keep patients prone until they're better. Cause let's say they're not better and you deprone them. What's the point? You can do x-rays posteriorly, you can do posterior EKGs, posterior leads for placement. We're defeating the whole purpose of what we're doing.
Gotcha.
That's the thought process behind it. Again, if you want to go strictly by the data, every patient in that trial was deproned every day. But you can do nursing care like this. I've placed lines like this. I've bronch and placed lines like this, believe it or not.
Really?
Oh yeah.
You turn the head to the side, you can bronch, no problem. right?
You turn the head to the side to bronch, and you can do IJs like this. I haven't done a subclavian like this, but I'm always up for a challenge. All right, good. Anybody have any questions while we have them bronch? No? Okay. Lori. Okay, good. All right, now how do we deprone? We'll bring his arm back down.
Oh, sorry, Chris, I didn't mean to almost break it.
We'll pull this.
What
That
was
was
it?
perfect.
That's what you get for
What you did for this morning?
So we have respiratory up here to hold Chris's head.
I thought we were gonna do it with the thing on.
Oh, you can do it either way. Here, I'm gonna do it with the thing.
I just wanna know what that feels like, yeah,
Okay.
so.
Lori really wants to talk to either
No,
me or you.
Josh.
Oh,
Okay, so now we do the exact same thing reverse. Go one way or another. Let's say he's coming to me.
well, yeah, he'll dig
It's
up.
more on that side.
Yeah.
So we're gonna pull Chris towards me. Right? We're gonna bring these legs, again, very important to take the Foley and the IV lines the way that you want. We bring them up to his side. We hold right there. Bring him more over to the side so that we don't overshoot and have him fall off the bed.
Oh, yeah.
This is also the maneuver for when you're changing pads and the sheets that are underneath the patient. We have him here, just like you guys do your rolls at 4 a.m. or 5 a.m. Roll halfway, change the sheets, and then put them back. Let's see. We pull this arm through. So the arm that was right here, we make sure that it's through on this side. Because our thoughts are, so we'll lift him a little bit. And usually there are 3 guys to help me. So now this arm's on this side. So that when we're done, everything's lined up the way it should be. And now everybody's ready. 1, 2, 3. Everybody together. Good. Bring them over. Boom. Done.
I wasn't ready for that.
Simple, right? Once you do it twice, you guys will be the kings and queens of proning. And you guys will love to do it. All it takes is 2 times to get really comfortable with it.
We're actually very excited and can't wait to practice.
Well, good.
Wow,